Welcome to A Shot in the Arm podcast. I'm Ben Plumley, and here we are in the wonderful Rio de Janeiro for AIDS 2026. And this is the second of 6 podcasts that we're doing with the International AIDS Society. They're the organisers of this conference and their Young Leaders Programme. And I am delighted that we are joined today by 2 young leaders from different parts of the world. The first, Noah. How do you do, Noah? Now, I blocked on your surname, so do you want to give us your surname?
Yeah, Noah Mancuso.
Noah Mancuso. And Edmond Soko. How could I forget your name?
You can forget.
Well, welcome, guys. It's really good to have you on the show.
Thank
Now,
you.
what we're doing in these podcasts is looking at your views on where the HIV epidemic is going. You've both made commitments at a fairly young age to pursue a career in this field. So what grabs you about that? And then what's exciting about the conference? What are you hearing on the Rialto, on the wonderful street corners that we have outside here with all the little food stalls? That's quite unique for an AIDS conference, I can tell you.
Yeah.
So Edmond, let's start with you. You're from Northern Province, Zambia.
Yes.
And I assume, given your T-shirt, you work for Grassroots Soccer.
Yes, so I work for Grassroots Soccer, Zambia.
So tell us a bit about that and how you got into it.
Okay, so I'll just speak into that in a summary. I am Edmond Soko, as he had mentioned, from Grassroots Soccer, Zambia. So I am someone who's been interested in the HIV field ever since I started my career. From the day I started my career, I have been interested in the HIV field. So I started working with the organization in 2025, November. And I just got drawn to the organization with what they are doing as Grassroots Soccer. So we do more focus on HIV prevention. And as someone who's been interested in the field of HIV, I've really wanted to work for such an organization. Professional, I am a clinical officer, by the way. You can do research in Zambia, we're called clinical officers. But now I am working as a programs officer or adolescent and young people's coordinator with the organization. Yeah.
Fantastic. And of course, Grassroots Soccer is an organization that is known to many of us as a leading form of reaching out to young people. So it's great to have you on the show.
Okay. Thank you.
And then from Atlanta, Georgia, United States of America, Noah, what's your background and how did you get interested in HIV?
Yeah, so my journey to HIV started in undergrad when I was at UNC Chapel Hill. I started working for the Center for AIDS Research. I think my own coming out story was fueled by the work that I was doing in HIV, listening to the community, interviewing folks. I think that really resonated with my own experience at the time. That was about 10 years ago, so I've been in the HIV field ever since. After UNC, I actually lived in Malawi, in Lilongwe, for a year, working on HIV prevention trials. Then I came back to the US and started working at RTI International and their Women's Global Health Imperative. We do a lot of clinical trial work in Sub-Saharan Africa and the US on HIV prevention. And I've continued to work with them as I'm now at Emory doing my PhD in epidemiology, focusing more domestically on HIV and how we can improve geographic access to preventative services in the US.
Wow, epidemiology in the United States. Now there's a challenge for the moment, hey?
Absolutely, yes.
So you've both got presentations, abstracts here. Noah, do you want to start first? What are you presenting?
Yeah, I have 3 posters. The first one's with RTI International, where we did a systematic review of barriers and facilitators to injectable PrEP for adolescent girls and young women. As we start to roll out lenacapavir, trying to get lessons learned from injectable contraception and injectable CAB to see how we can ensure those who need it stay on it and stay on it for a long time. For Emory, I have 2 posters. One is looking at the impact of the federal funding cuts on geographic access to PrEP in Atlanta and how that's impacted and will continue to impact the city and beyond. And then another one is a review of mobile health interventions over the past 20 years for HIV prevention and treatment, how those have evolved and how the research world has not really translated into the real world, looking at how much funding the federal government has spent on it and how we only have one evidence-based intervention app on the app market in the US. So kind of where that disruption is.
So, I mean, all three are very interesting, but the one that comes to mind just at the moment is the impact on services in the United States. Without wanting to give too much away before your poster is presented, what are you seeing?
Yeah, so we're seeing community-based organizations are being impacted the most, given they are most likely to depend on federal funding. And those cuts are impacting racial and gender minorities the most.
Yeah. I think that's an experience we're also seeing on the West Coast very much.
Yeah.
I put a different hat on and I'm chair of the San Francisco Community Health Center, which provides wraparound HIV services to the most marginalized of the marginalized. So the homeless, trans, drug-using populations. And it's a hard struggle to keep those services going.
Yeah, absolutely.
So Edmond, how about you? What have you got presenting here?
Okay, so I had mentioned earlier that I work with Grassroots Soccer, and it is an organization, an adolescent health organization that uses the power of soccer to provide life-saving information and mentor adolescents to live their healthier life, I mean. So with me, my presentation talks about how, as Grassroots Soccer, we are reaching out to rural adolescents using a youth and a play-based model, which I see as something that has really helped us reach rural adolescents, in that they normally face a challenge in accessing HIV services. So that's some of the presentation that I'm doing.
And I guess one of the great things about Grassroots Soccer is that it both brings HIV information to young people where they're at, rather than forcing them into a clinic.
Yes.
But using the messaging that comes with soccer, football as we call it in the United Kingdom, but bringing that as a vehicle to get those messages across, to make people feel safe and you're a trusted voice. How does that play out in practice for you?
So it is really working out. And maybe I can speak more into how we use the power of soccer to educate. So as Grassroots Soccer, we have some curriculum that were developed. We have 5 that were developed. In this curriculum, we have the key messages on HIV. Most we talk about HIV prevention. And how soccer comes in is that we use game activities to showcase on the risk factors on how maybe an adolescent can acquire HIV infection. So we just use soccer activities in doing the teaching of the adolescents most of the times.
Yeah. So coming onto the conference more broadly, is this your first conference, both of you? You've been to one before?
This is my second. I was at the AIDS conference in Munich previously.
So me, it's the best one.
So this is your first one?
Yes, yes.
So I'm interested to know how you, I mean, we're recording this at really the very start of the conference, but what feeling is the vibe? What are you sensing? Noah, how different is this from Munich?
Yeah, I think Brazil is very different from Germany. So I think the social environment here has been slightly different. I think the attendees themselves are in a bit of an interesting space as we try to traverse the international funding impacts from the US and other countries cutting back and rolling back their supports, but also just the excitement of having everyone in one place and like getting the youth in the global village all together is very energizing. So it's a mix of both of those tensions. So I'll be very curious to see how that rolls out throughout the rest of the week.
Yeah. How about you, Edmond? You've been to a few sessions already. What's your sense of what's happening, this craziness that is happening around us?
So I am really enjoying the sessions, and I think I had some expectations. And what I expected the conference to be, I think it's coming to pass, and it's true with the expectation that I had. So when I was coming to the conference, I really wanted to learn more about how others are working towards epidemic control in HIV, which I've seen some good number of presentations that have been made, which are very much good, and I've learned a lot from that. And I hope to continue learning more, since this is just the first day of the conference.
For me, this is a really interesting conference in that for the first time in quite a while, we have really strong presentations from the biomedical side as well as the behavioral side, particularly about new drugs and delivery mechanisms. And I suppose, Noah, this is probably more directed to you. What are the innovations you're excited to look at?
Yeah, I mean, the big one that everyone's talking about is the new monthly pill. I feel like there's been whispers of that for the past couple of years, so it's super exciting to see that being rolled out soon, and loving seeing the ability to, I don't know the exact words, but produce it in other countries, hopefully affordably, and maybe not having similar missteps to other innovations where access was the key issue in rollout.
Yeah, I mean, we're talking about Merck and their weekly prevention pill. Is it prevention or is it treatment? It's prevention. Yeah. And for the very first time, and old folks like me have been working on this for years to try and get companies to make a commitment to access as early into the regulatory process as possible, so that we're not rushing at the end of it. And so this is the first time a company has identified generic partners as it submits its regulatory submission. So it's good news, I think, all around. We just have to hold their feet to the fire. I'm quite sure there's no question about their commitment here. And then hopefully we can get these innovations to the northern province of Zambia soonest. You've both decided to work in HIV. Is it living up to expectations? Are you finding that what you thought you were going to be doing, is it sort of turned out the way you wanted or not?
So for me, I think it is working out for me, because one thing that I really like is seeing a healthier generation of adolescents, and using our model as Grassroots Soccer. It's really making me happy to see that we are reaching out to those hard rural areas to reach, and we're really reaching out with our model. So for me, it's working out.
How about you, Noah?
Yeah, I think so. Starting, looking back 10 years, probably hard to predict some of the innovations we've seen since then. But I feel like the commitment from the community to work with those most at need has continued. The innovation has grown exponentially, and I think we've seen the impact of HIV world outside of HIV with COVID and the methods and skills used from HIV to respond to that, the innovations in drug development helping cancer and obesity in many different areas. And I think that is what has kept me in the field so long, is the continual innovation and the commitment to the community.
And we're coming at this against a backdrop of major funding cuts, primarily by the United States, domestically and internationally, although they're not the only donor, like the UK, to cut funding. That puts a very different perspective on things. And for, say, us old people, or folks who've been coming to this conference since the early 90s, we feel as if we'd fought those battles, that we had got a civil society and cross-governmental commitment to responding to AIDS. And here we are in 2026, and you guys are fighting exactly the same battles that we fought 30 odd years ago. Feels very strange. What's your level of optimism as you come into this? Do you see the possibility of ending AIDS in the coming decades, or is this just something we're going to have to live with? Do you want to give it a go first?
Sure. Yeah, it seems like history does repeat itself, but I think in that same sense, the HIV field and the community that is involved has always been scrappy, and we've tried to make things work. So I've seen a huge pivot away from federal funding into private pharma, donation-based work. And I think that will be a necessity, and that sometimes sparks innovation in itself. So I'm hopeful of the future. I do think we need to maybe reevaluate and reassess how we're going to get there. But excited to be part of that as the next generation.
How about you, Edmond? Are you seeing the impact of funding cuts in your work in Zambia?
So for that one, yes, we have felt the impact. I won't comment more on that, but we've really felt the impact. And I believe epidemic control can be achieved by first looking at where we get the more HIV new infections. So with the right information and with the right services, providing right services in the communities, we can manage controlling the epidemic.
I like that optimism. I got to say, it's a little hard to see it at times at this conference. But I mean, the other aspect of this conference is that it is a crazy bazaar, a lot of activism happening. And I think back to my first conference before the dawn of the age of time or whatever, 1993. I helped carry a cheap imitation coffin to the British Embassy in Amsterdam with a group of activists. And I was thinking at the time, what in heaven's name am I doing? Thankfully, I've not come across any photographs from that era, but you're going to see some really out there, very interesting and very passionate levels of activism at this conference. And I hope, that those come in and inspire you. As we look forward, just sort of getting your sense of the trends of how the epidemic will play out. We've talked about new therapeutics, education and awareness opportunities, particularly through digital and social media. I mean, when I first started, who knew that we would have a portable phone like this that you could access something called the internet from? But there we are. And, and then the other thing, dare I say it, there's still a lot of work going on for the cure. So, Noah, maybe starting with you, what are the trends that you're seeing that are both appealing or which could be challenges that we have to watch?
Yeah, I think an interesting thing within the mobile health space is the use of AI everywhere. Everything from screening EMRs to predictive assessments for transmission to AI chatbots helping people understand an HIV diagnosis or HIV prevention. And I think that is really exciting. But on the same side, we know the environmental repercussions of AI, the way that AI is often trained, leaving those most vulnerable at risk or, disproportionately affected by mishaps. So I think it'll be a fine line to both use and optimize AI responsibly.
I was talking to one of the co-chairs of the Lancet Commission on AI and Health, Solange Baptiste-Simon, who is the executive director of the International Treatment Preparedness Coalition. And she said something to me that was really interesting. But for the first level of information gathering, it may be better for folks to use AI to say, what are the risks of transmission for trans populations or gay populations? And that you'll get a level of relatively unbiased information first up front than if you were to talk to your doctor or your healthcare professional who might have perceived biases of their own. And I thought that was really interesting. Is that something that catches your attention too?
Yeah, I think that seems like it could be feasible. I think the important part is always like the human in the loop. So making sure there is that human side after that to knows the patient best one-on-one. I think AI misses a little of the empathy that is needed in medicine and treatment and prevention. But I can definitely see the the pros of AI to kind of simplify and speed up that process and remove some human bias, because there's bias in both human and AI use.
Well, and the people who originally wrote the codes
exactly.
that start rewriting themselves, that point of origin carries its own prejudice. Edmond, is this something that concerns you, that you're interested in? I mean, I presume many folks have their own bundles, presumably with Facebook, the old Meta.
Okay, so for me, I think it is a good thing that we are now living in a digital world, and hoping just that we will be using that for the right purpose. You see, in the old days, it was very much hard for people to get information. So now, since we're in a digital world, it's easy for someone, even someone who is young, they can access each and every information that they want. So it's just up to us as youths to continue educating everyone in the society on what to choose when you go on the internet. I think that will really help us. But I've seen a lot of advantages to the internet, the digital world right now.
It's good and bad, isn't it? Because
yes, it's good and bad.
Plenty of misinformation out there, which again, your generation is going to have to work out how to deal with.
Yes. Now we can't. Our generation, sometimes it becomes hard for us to control them on what they look for on the internet. So we just have to continue talking to them or telling them what they should look for when they go on the internet.
And it sort of strikes that balance, doesn't it, between free access to whatever you want versus, the more extremes of the internet. Noah, what's been your sense, particularly from an epidemiological perspective, in how we can use these advances in telemedicine, in AI, for health, and particularly for hard-to-reach populations in Atlanta or San Francisco?
Yeah. I think there is a lot of opportunity. Telemedicine and telehealth is one way that we can reach a lot of people in rural America, which is some of the work we're doing at Emory. If you have to drive 30 minutes, 60 minutes to get to a clinic that's going to prescribe you PrEP, it's going to be really hard to maintain that over a long period of time. Additionally, we can use those telemedicine visits to reduce stigma of going in person. Maybe you're afraid that you're going to be seen going to a sexual health clinic. Or if you're in a small town, you may know the provider because they know your parents, and you don't want to have those tough conversations. So there is a way that we can use these technologies to reduce stigma and improve access, especially for these key populations that are very vulnerable.
And both of you come from very different cultures. But I wonder how, over the course of the response to the pandemic, addressing stigma and discrimination has been a central tool. How effective? I don't know. But are you seeing improvements, say, from your parents' generation to now your generations, in the way people think about HIV?
Yes, there's some improvement. Stigma has really been reduced, stigma and discrimination, because of the same information that we tell them. So from my continent, and specifically Zambia, I've seen some great improvement. But we've not just stopped preaching about not stigmatizing. We are still doing the awareness. We are still spreading the awareness of stopping stigma. So there is improvement.
Do you see improvement or a step backwards?
Yeah, I would say overall we've seen improvement thanks to many folks like Edmond. I think the US has learned a lot from Africa on how to destigmatize and talk about HIV. I think we've seen more representation in social media, which has been great, but it's really hard to combat that when we have an administration and representatives who are maybe taking us back a few years.
completely agree. And I think one of the interesting aspects of this conference, honestly, really, it's the first time we've been able to come together as a community and really understand the impacts of these funding cuts domestically, but also internationally. And I'm very conscious that we're sort of seeing, I wouldn't call it an uprising per se, certainly more vociferous opposition to what has happened to us. And you see that across the medical community, of course, the activist community and the NGO community. So we're coming up to the top of the hour. What have we missed? What are the things that, you feel, Ben, we really need to talk about this, and you idiot, you haven't raised these things?
Yes, that's it.
Oh, where to begin here?
I think an interesting thing is just the role of the next generation as the youth ambassadors here to the conference. It's so cool to see how many different things folks are doing from all the different angles, from journalism, from medicine, from psychology, from community activism. And I think this next generation has a really good shot at making a big difference. So I think it's just really cool to be here and be part of that. Yeah.
Yeah, then for me, I think everything has been said. I just hope that soon everything can come back to normal, because the impact that the budget cut has caused is more damaging to the society out there, because it's not only the communities that we come from that are affected, it's everywhere in the world. So we're just hoping for the best, and I was just hoping for everything to go back to normal. That's
Well, there's one thing you haven't raised, and that is that when we first met to prepare for this podcast, you deeply, deeply offended me by wearing a Chelsea strip t-shirt.
the best team in the world.
And I had, to my embarrassment, to admit that my team, Fulham, just down the road from you, but in a completely different league. In the metaphorical sense. So look, guys, thank you so much. I hope we can come back later in the week and see how your presentations have gone, what your sense of how the conference is playing out for you, what you're learning. But for now, thanks so much for joining us.
Yeah, thanks for having us.
Thank you.
Well, that's it for this episode. Thanks to Eric Aspera, our director and producer from A Shot in the Arm Media. Thanks also to Teddy Bourgogne and Daria Besting from the International AIDS Society for arranging this partnership. And then finally, a big thanks to you. You can find our podcasts wherever you download your online content, and of course on our YouTube channel. So with that, have a great day and a safe day, everyone.